Well, I was diagnosed with prostate cancer, and I went through the operational phase of that to remove the prostate, but unfortunately they couldn't complete the operation successfully, just purely because of my anatomy, I suppose. And I was referred to the Mater Hospital here to undergo radiation therapy. And it was only when I came here and saw the doctor here that he suggested possibly going on a trial. I didn't even know that existed here at the time. And I didn't really think twice about it, actually. I thought, well, going on a trial is a good idea because, rightly or wrongly, I guess there's a stronger focus on the outcomes of the trial. And after I read a little bit of information about it, which they passed on to me, I just thought that why not? The trial I was on was called PROPHET, which was associated with improving the outcomes of radiotherapy for prostate cancer. And from the little I understand about it, really, it focused on more accurate radiotherapy of the prostate in different directions around the body, so that it did less damage to the other tissues around the body. And so I guess I thought I was lucky to go on that trial, actually, because there was clearly a focus on trying to improve the outcomes of the radiotherapy. And in my case, it was purely a case of whether I went on the normal standard length, which was what, about 8 or 9 weeks of radiotherapy every day, apart from weekends. You got the weekends off. Or the intention was to reduce the time frame, because clearly 8 weeks every day is a lot for people, particularly those that work. And I went on the 8-week program. Some people did the 4-week program. And I guess the outcomes of that were an attempt to understand whether there was some benefits to the shorter term trial. So I was impressed with it, and I was quite happy to go on the trial. I mean, it's horses for courses. I guess people have to make their own minds up, but I was given quite a bit of information here about what the trial was and what it was trying to achieve. I went on the internet as well to read a little bit about it, which was there. Didn't hear anything about TROG, of course, as I said earlier, but there was enough information there for me to weigh up in my own mind whether I thought I'd see some benefit from it. And of course, my experience of radiotherapy is zero up until that stage. Well, yeah, but at the same time, you know, by comparison with being told you've got cancer, it's, you know, nothing, really. Yeah, it still hits me occasionally when I think about the original shock of being told. But after that, and of course, prostate cancer, if you're going to have cancer, that's the best one to get, I guess they say. Once I got in that frame of mind, I thought the idea of a trial like that, given the information I read through, I couldn't see any risk in it. I didn't know what the other experience was either, so what's to choose, you know? Well, yeah, I mean, first of all, came here. I was first inspected by the local radiation doctor, and he suggested, as I mentioned earlier, that I go on to this PROPHET trial, and I was given some information to read through, which gave an understanding of that. My understanding was I'd take part in this trial, I'd come along and I'd either do a 4-week intensive radiotherapy trial or the standard 8-week trial. As it turned out, these random numbers were drawn, and I got the long straw, the 8-week trial, which didn't bother me at all. But with this more focused attention to accuracy of radiotherapy. Got a CD from the Mater Hospital here, which was an excellent introduction to what to expect when you come here as a oncology patient. And that was really good. It kind of gave you an understanding of what you'd have to do when you were here, how long the treatment would take each time, what the machine looked like, so you didn't get awestruck by this kind of Doctor Who TARDIS, you know. That was brilliant. After that, it was really kind of a matter of getting to know the people. You've got plenty of opportunity coming every day, and then basically lying still for 5 or 10 minutes on this platform while this radiotherapy device did its task. That was it. It was a good introduction. You feel a bit apprehensive, of course. You've got to lay there and you've got to stay still, but I didn't find it really difficult. It was just a matter of, after the 3rd or 4th go, you know, you feel like you're an old hand at it, basically. You tend to meet the same kind of people when you're coming there, going, and so on. And don't get much of a chance to compare notes, of course, but yeah, I didn't really find any problem with it. And I was lucky enough I didn't see I had any side effects from it at all. So all in all, I feel I was quite lucky. Yeah. So far, so good. I mean, when I was diagnosed with prostate cancer, it wasn't a particularly advanced situation. In fact, my PSA level, which is how they found it originally, was only marginally above what it should be for my age. So when I first was suggested by my GP I go and get a checkup with an oncologist, I thought, oh, well, nothing's going to come of this. And then after they did a sample, told me I had prostate cancer, it was a bit of a shock, you know. It was, well, a hell of a shock. So from then on, I kind of just got into the mode of wanting to get better. And my first thought was, if it's cancer, get rid of it. So hence the idea of an operation. When that didn't come to fruition, of course, came here. Hadn't really read much about the radiotherapy side of it, and when I did go through it, I started to think, well, mate, maybe I should have come to the radiotherapy first and not bothered with the operation. Because, of course, the operation's, to my mind, more traumatic, having had the benefit of both experiences. So, yeah, no, I can't fault the whole thing at all, actually. I felt at ease all the way through it, as much as you can. The people here were great, and the whole thing was organised, you know, when you think every 15 minutes every day for 8 weeks, it takes a bit of organisation, but it was brilliant. 5-minute wait before you go in, and there you go. Yes, my radiotherapy finished, you know, for 2 years now, I guess. It's one of those things you can tend to try and forget about, I suppose. But the part of the trial program required that you come back every 6 months and have a review with the doctor concerned or the registrar, and do a regular blood test just to check the PSA. As the prostate-specific antigen, it's a level of antibodies, I guess. I'm not sure of the correct medical term, but it's a level in the bloodstream that indicates an infection or something trying to assail the prostate, be it a cancer or be it something else. So I guess it's a measure of whether the prostate's under stress. The higher it is, depending on your age, then the more likely you are to have had prostate cancer. It's as simple as that. Every 6 months for, I guess, I don't know how long. I might be coming back here when I'm 100. But I guess from my point of view, I'm really not working anymore. So there's no real issue for me to be able to come here. I took a few months off casual work I was doing when I went through the trial, the radiation therapy. So it was kind of more or less, it was just a matter of turning up here. There wasn't really any stress for me. People that work every day, of course, that have to come in here and then back out, different story. But no pressure at all, no. I was actually kind of happy with the idea. As soon as the doctor mentioned a trial, I thought, well, I think there's an advantage in being involved in the trial compared with your normal patient situation, because people tend to, I think, focus more on that. I might be wrong, but that was just my view. Well, the detail and the follow-up afterwards. Whereas if you go to hospital normally, you know, once you've gone through the treatment and you know, off you go and it's hooray and that's it basically. Well, if it's anything like the one I went through, I'd say get as much information as you can about what the trial is and what it means to do, so you can weigh up in your own mind, and if necessary you can ask the doctor questions, you know. Are there greater risks? Are there less risks? My view in my case was that the distinct possibility was there'd be less risks because it was focused on more accurate radiotherapy of in this case the prostate. And read through that information, make sense of it, ask a few questions, and go with the flow. If you feel there's a great risk in it, then you have to make your own decision. But I don't see an issue with trials. I don't think people are put that much at risk unless the situation demands it. Yeah, I see a distinct benefit in that and follow-up. So I'm not sure that I'd be getting the same level of follow-up if I'd been, shall we say, a standard patient. Now, some people might not want that follow-up personally, others might. But there's no kind of feeling you're coerced into having to turn up. I mean, you can decide at any time you don't want to be further involved, so what's wrong with that? And you feel as though kind of in a little bit you might be helping, you know. Well, most of these trials, I guess, are set up with a degree of forethought that's either going to try and improve the outcome, or in this case, I think the emphasis was probably on reducing the amount of treatment required, or the timing treatment, which for a lot of working people obviously is a benefit. So on the basis that most trials are set up to try and improve the situation, then being involved with them, from my point of view, suggests that that might be helping humanity.